Suicide prevention. September is National Suicide Prevention Month, also known as Suicide Awareness Month. The month shines a spotlight on a topic not often talked about. Everyone is affected by suicide, not just the victim. Suicide impacts family and friends long after the loss of a loved one. On average, one person commits suicide every 16.2 minutes. Two-thirds of the people who commit suicide suffer from depression. We produce 5 videos per week, so please click on the like button and subscribe to see future videos. Like, comment, share, subscribe. Many suicides happen impulsively in moments of crisis with a breakdown in the ability to deal with life stresses, such as financial problems, relationship breakup, or chronic pain and illness. In addition, experiencing conflict, disaster, violence, abuse, or loss, and a sense of isolation are strongly associated with suicidal behavior. Suicidal traits are also high amongst vulnerable groups who experience discrimination, such as refugees, migrants, indigenous peoples, lesbian, gay, bisexual, transgender, intersex, LGBTI persons, and prisoners. It is estimated that around 20% of global suicides are due to pesticide self-poisoning, most of which occur in rural agricultural areas in low and middle income countries. Other common methods of suicide are hanging and firearms. Knowledge of the most commonly used suicide methods is important to devise prevention strategies which have shown to be effective, such as restriction of access to means of suicide. Suicides are preventable. There are a number of measures that can be taken at population, subpopulation, and individual levels to prevent suicide and suicide attempts. Live Life, whose approach to suicide prevention recommends the following key effective evidence-based interventions. Limit access to the means of suicide. Interact with the media for responsible reporting of suicide. Foster socio-economical life skills in adolescents. And early identify, assess, manage, and follow up anyone who is affected by suicidal behaviors. Stigma, particularly surrounding mental disorders and suicide, means many people thinking of taking their own life or who have attempted suicide are not seeking help and are therefore not getting the help they need. Suicide is preventable and everyone has a role to play in saving lives and create healthy and strong individuals, families, and communities. Suicide prevention requires a comprehensive public approach such as strengthen economic supports, strengthen household financial security and housing stabilization policies, strengthen access and delivery of suicide care, coverage of mental health conditions in health insurance, reduce provider shortages in underserved areas, and safer suicide care through system change. Reduce access to lethal means among persons at risk. Organizational policies and culture, and community-based policies to reduce excessive alcohol use. Promote connectedness. peer norm programs and community engagement activities. Teach coping and problem-solving skills, social-emotional learning programs, and parenting skill and family relationship programs. Lessen harms and prevent future risk with postvention and safe reporting and messaging about suicide. Identify and support people at risk with gatekeeper training, crisis intervention, treatment for people at risk of suicide, and treatment to prevent reattempts.